Okay, so good afternoon to everyone, even though it's rainy. But all of us have imbibed and already conditioned ourselves that we will learn in spite of the weather condition. It will not hinder us definitely to learn pharmacology. Last time we had already the discussion that is related to the introduction of some of the concepts of pharmacology. And indeed, I have already introduced to you some of the concepts and the learning outcomes. And these learning outcomes are very significant because it is very important for all of us to have a mindset of safety whenever we give medications to a well or sick individuals. Last time we had a discussion pertaining to the topics on what are pharmacotherapeutics, what are pharmacokinetics, and what is pharmacodynamics. So we have mentioned some of the overview, and later on we'll go through with the details of what is pharmacotherapeutic, pharmacokinetics, and pharmacodynamics. We had mentioned last meeting that the kinetics and the dynamics has somehow related to each other from the term pharmaco. As the drug enters the body, it will give us the concept of movement. Okay? It will give us also the idea on how the drug will be distributed through the plasma. So as what I have mentioned last time, the component to the blood, which is plasma, has a major role when it comes to the distribution of the drug to its indicated system or organ. We have mentioned also about the difference between no approved therapeutic claims and those with therapeutic approval. Those two that I have mentioned, the praise that I have mentioned to all of you, have definitely approval of the Food and Drug Administration of the Philippines. However, they have been classified into two because the no approved therapeutic claims may serve, it is safe for human consumption, but there is no direct, specific, and clear statement that it will treat any certain health condition. If we say therapeutically approved, then those are the drugs that have been identified but still approved by the Food and Drug Administration specifically on its indicated system or type of health condition, which I have mentioned to all of you, those drugs, salbutamol, respiratory drugs, metoprolol, these are cardiac drugs. So these have been classified into the specific what? Specific actions or mechanism of actions that targets the system or the organ. We have mentioned also some of the terms, specifically pharmacotherapeutics. The pharmacotherapeutics may give us the idea from the term itself therapeutic. So I have mentioned about no approved therapeutic and those with therapeutic. The pharmacotherapeutics may give us the idea of the mechanism of action and how this drug leads to the treatment of the certain condition, how it will act to the body. Now, number two, we have discussed also about toxic effects. However, you may encounter the term toxicology. So moreover, this is all about, if we say ology, we are talking about the study. So obviously, it concerns with the study of the toxic, the toxins, and the toxic effect of the drugs. I just want to ask if you can still remember, what are the two major organs that are significant when it comes to the prevention of toxic effect of the drugs? Can I hear from the
Liver,
students? So
liver
remember,
and
Liver and
pancreas.
kidney
kidney.
And kidney po.
and the kidney. So thank you for some who's raising the hand. So I have seen those, and I also acknowledge a chorus. So thank you for that. Your answers are correct. The liver and the kidney. That's why we emphasize protect your liver or liver. Protect your liver and definitely protect your kidneys from any abuse and damage, because I even reiterated during our last discussion that most of the drugs are hepatotoxic, liver toxic, and some may have nephrotoxic. So most of the drugs are nephrotoxic and hepatotoxic. So that's why the action of the liver is the one that detoxifies. It means that the action of which is it will filter the drug that is only sufficient for the need of the body. The excess is will be, or the excess are rather, will the properties that are in excess will be removed out of the body to prevent toxic level. So that's why it is now the elimination is now the responsibility of the kidneys. Sometimes there are some drugs that may be eliminated not just only via urine. There are some drugs that can be eliminated via sweat. That's why when someone have taken drugs, there are some odors that you may smell to these individuals, because there are some situations that elimination may pass through the skin and through the sweat. Some of the drugs may be eliminated through the GI tract, specifically via the intestine. And for some, a typical example, for some who are taking iron-based drug, ferrosulfate, those drugs with iron, the effect or the excess of the iron will be removed via the GI tract. So that's why expect the color of your stool is dark for those who are taking iron-based drug. So that's why when I introduced to you before, when someone is taking vitamin C or multivitamins, our expectation is there will be discoloration of the urine. But as nurses, we must know what is the normal response of the body when it comes to the color of the urine and which color is not anymore acceptable. So you have mentioned last time that we have almost yellowish in color, orange in color. Okay, that could be acceptable. But if it is beyond that, tea-colored urine, dark orange urine, that is not anymore the response of the liver via the kidney when it comes to the drug that you have taken. For iron-based, there could be misconception. That's why health assessment had been introduced to all of you, so that you may be aware of the color, the consistency, which is very important for the nurse when it comes to identification of which are a deviation of your assessment findings. Usually, when you will identify a dark colored stool, that could be an indication that there could be GI tract bleeding. That's why whenever you will ask a client who may have dengue, and then the stool that you have observed is dark colored stool, so you may suspect that there is already a GI tract bleeding. But again, as a nurse, you must know and ask if the person have taken an iron-based drug, which is somehow on the knowledge of the nurse, you must think to identify that if the client is not diagnosed with dengue, or possibly may have dengue, or possibly the discoloration of the stool is caused by the iron-based drug that the client have taken. So those are the responsibilities that are very important for a nurse, because this may direct the healthcare team on what could be the clear care management that we will prepare and plan for our client. Our existence as a nurse is to become effective. You will become effective if your care management will be evaluated with what you have planned or what you have indicated in your planning. However, don't be disappointed if you have not met and you have not succeed the standard. That is a way that you need to revisit your care plan or reevaluate your care plan. So the toxic effect could be fatal simply because this may lead to damage of tissues and eventually cells. If the cells will be damaged because of the toxic level, this may affect major organs and possibly may lead to multiple organ dysfunctions. Number 3, we have also reiterated last time the importance of nursing process. And the nursing process is assessment, planning, intervention, and we have the evaluation. So I forgot the ADPI. So that's the diagnosis pala, I forgot. So we have the assessment, the diagnosis, the planning, the implementation, intervention, or evaluation. When we are about to give or to administer drug, it is very important for all of us to set our mind that assessment is very important. It doesn't mean that if the doctor prescribed a drug, all of which must be given to the client. Sometimes the nurse may have this misconception that everything that had been prescribed by the doctor must be followed accordingly or must be given to client without any hesitancies. No, because nurses have independent function. We are identified with our own responsibilities and skills, competencies, which may alarm the healthcare team if it may not pursue specific drug. So that's why when we talk about the time of drugs such as the beta blocker, those drugs ending in olol, one of the examples that I gave you is the drug had been prescribed by the doctor. This is simply to treat or to support problem with hypertension. However, when the nurse checked the vital signs and recorded below 60, go back to your knowledge that the normal heart rate is 60 to 100. So you have been oriented that beyond 100 is tachycardia and below the 60 is bradycardia. And once with the action of the beta blocker, we are oriented. And if you have learned about beta blockers, this slows down the heart rate. So if you still give the drug, will it compromise the safety of the client? The answer is yes or no. If you can still give, for example, you have revealed that the heart rate I have mentioned is 52. The doctor prescribed it. Will the nurse have the right to withhold the drug? Yes or no?
Yes.
Yes. We can rationalize and confidently rationalize that I withhold the drug because the vital signs, the term itself vital, is very important because 52 is below or a deviation in the heart rate. And this may compromise condition of the client. Another example on this is why nursing process is very important. For example, as what I have told you, the computation of dosage of drug is dependent on the weight of the client. And it is very important, very basic. That's why we may have different dose for pediatric and we may have different dose for adult. Those differences makes us makes our role specifically promote safety to our client. So that's why it's very important for us also to embrace math and computations as well. On that note, when, for example, the client will be subject for operation, okay, and the client will be given pre-medication drug. So, for example, the client has blood pressure of 80/60. And the drug that you may give may cause the possibility of pre-anesthetic drug. So can you imagine if we will go back again to the foundation of the anatomy and physiology, can you still remember the action of nervous system? Most of the anesthesia affects consciousness. Am I right? Okay.
Yes.
So if the anesthesia affects consciousness, usually the action of, if you can still remember in the nervous system, the fight or flight, if you can still remember that, the sympathetic and the parasympathetic nervous system. If you can still remember it, so the sympathetic nervous system is the adrenergic and the parasympathetic is the cholinergic. Now, most of the anesthetic effect is with the parasympathetic nervous system or cholinergic. And what is the action or what is the effect if it stimulates parasympathetic to the heart? Will it increase heart rate or will it slow heart rate? Okay? Anyone? The parasympathetic effect or cholinergic effect, if it is stimulated with the anesthetic effect to the parasympathetic, what is the effect to the heart? It will slow the heart rate or increase the heart rate?
Slow po.
Slow the heart rate. Very good. Now, the client has 80/60. You will now give a pre-anesthetic drug which may have parasympathetic effect, which you are aware that the drug with parasympathetic effect may lead to slow response of the heart. Will it cause ba a problem with safety if you will still administer the drug and have the findings of 80/60 blood pressure? Will it compromise safety if you will administer the drug? Yes or no?
Yes.
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 Yes po.
Very
Yes po.
good. Because because try to imagine, 80/60 is already hypotension. If you have learned about vital signs, it means that if the heart manifests hypotension, the heart is exerting less pressure. Kaya nga hypo. If the heart is exerting less pressure and you will still give a drug that will slow the heart rate, will it compromise also the dropping of the heart rate and blood pressure? Yes or no? So silence. I will repeat. I will repeat. If you will you still give the drug to a client which appeared to have 80/60 blood pressure, and you are aware that the pre-anesthetic drug leads to a parasympathetic effect and may slow heart rate, will you still give the drug? Yes or no?
No po.
No po.
No. Because
No, sir.
setting the basic idea that pre-anesthetic drug leads to slowing of the heart rate because of the parasympathetic response. Why a nurse will still give the drug and yet it will compromise the safety and chances that it may drop the blood pressure and somehow may lead to cardiac arrest? So that's why the nurse can still withhold the drug. You have the right to withhold the drug and refer it to the doctor. So probably the doctor will definitely agree with you. Because sometimes there are instances that if the client have low blood pressure, it will delay the operation or somehow it will hold the operation because once anesthesia will be given intraoperatively, it may cause possible sudden drop of blood pressure, and anytime during operation, the client may lead to mortality. If that's so, you still give the drug. You are aware that the pre-anesthetic effect is lowering the heart rate. You can say ba, if ever, it may lead to a legal perspective, the doctor prescribed it. I'm part of the healthcare team. I'm doing my job. I'm doing my job. I just gave the drug. But we are empowered with critical and analytical thinking. That's why we need to consider what will take risk and compromise patient's condition. So if the nurse will say to the whole healthcare team, I decided to withhold the drug basically because of the blood pressure of 80/60, and the pre-anesthetic drug may have parasympathetic response, and we are aware that the heart may lead to lowering of the heart rate. That's confidence. That's confidence that you will develop once you end up with this course in 6 weeks. that anytime that you will be asked, you will be confident to decide, ma, don't take the drug. Why, anak? Your blood pressure is 80/60. I will be for operation. Ma, because this may lead to the possibility that your blood pressure will have a sudden drop because the pre-medication drug, which is the pre-anesthetic, may have parasympathetic response. And that parasympathetic response may have an effect with the heart and slows heart rate and may drop your blood pressure, mama. Gagalit. So on that note, your direction now is the safety of your mom, in spite of those who are insisting to still give the drug. So those are conditions by which we need to inculcate into our minds the importance of nursing process. Because even in the board exam, you will use analytical and critical thinking, situational approach, and you decide what's the best. Probably the four choices in the board exam are correct. All you have to do is to choose the best that will be safe and will promote safety to your client. Later on, I will present to you some of questions, sample questions that were derived from NCLEX. The NCLEX are those examinations that are being administered when you wish to go to abroad, and some questions that are retrieved from the local board exam. In every session that we have, we will end up with questions that I have retrieved related to this question or bank question bank. Question banks, tama. Which will lead to the possible training not possible. It will lead to training and have your mindset to really claim the RN to your names. Now, other than the nursing process, number 4 is discuss safety guidelines for drug administration. Actually, in the US preferred safety guidance in drug administration, we have 5 rights that you need to understand, you need to know before administering the drug. First and foremost, right patient. Very obvious. You will administer the drug to a patient which is not the one who have been prescribed. Oh, come on, that's number 1. Right patient must be the one you must identify. Second is the right drug. Third is the right dose. Fourth is the right frequency. And 5 is the right time. Those are the 5 rights that are basic for us to administer. Why? Right patient, right patient. If you will not administer the drug to the right patient, will you be sued? Yes. Would you want to have those drugs that had not been prescribed to you? Oh, come on. This is not a sound decision because it may have a concern with safety and soon it may lead to a legal concern. Right drug, obviously, regardless of the brand name, we may focus primarily on the generic. That's why I will introduce to you on how you will learn generic names rather than brand names because that is very important. The right drug and the right dose. Okay, number 3, the right dose computation that will be very important and appropriate for the weight of the client, for the age of the client, that is appropriate for the condition of the client. We have the right frequency. The right frequency is, for example, if you will give the drug 3 times a day, then you must be aware of the next, which is the 5th, the right time. The proper timing is very important because we all know that the drug may have the physiologic effect to the body. So we must meet the 100% effect of the drug. If we will not administer the drug on the right time, it may not meet the mechanism of action or target of the drug. For example, antibacterial drugs, antimicrobial drugs. The purpose of antibacterial and antimicrobial drugs is to inhibit growth of microorganism. But if you have not administered the drug on the right time and frequency, it may not meet the possibility of the purpose of inhibiting its growth. Rather, if it will delay the administration of the drug, it may lead to the possibility of giving chance and window for this microorganism to multiply again. That's why most of the drug, I know that you have been oriented with it, 7 days. You need to complete it within the 1 week or 7 days. Some Filipino mentality may have this, anyway, I don't have any more symptoms. Anyway, I don't have any more fever. Anyway, there's no presence of pus and there's no redness in the wound. Plus, 24 hours, you may not inhibit the growth of microorganism. It takes time. It may inhibit some growth, but there are still other bacteria that will increase naman the multiplication or the growth itself and its synthesis. So those safety guidelines are very important, and this will be elaborated with the next discussion or part of the discussions that we may have. Okay? Now, basic to the concept of the pharmacology is merely on the, this was the asynchronous session last time, merely on what pharmacology is. I am presenting now on the slides what are the various definitions of pharmacology. Actually, the first one is it derives from pharmakon plus logos. So usually we take into consideration logos as a study. Remember, you have been oriented on the concept of science ever since. Since elementary up to tertiary, we will not get away from science. Why? Why science? Because it orients us in science on how to deal with approach of inquiry. Why? It can answer the how and the whys. And in this regard, when it comes to pharmacology, we consider science because it presents a systematic way of analysis. What do we mean by systematic way of analysis? On how the drug had been prepared, on how the drug had been administered, on how the drug has the physiologic effect to the body, and on how the drug prevents toxic effect. So study and the chronological order of events once the drug entered the body is very significant because somehow for a nurse, it could be a preventive action if ever you discovered that the drug is already reaching adverse effect. So last time we have defined adverse effect and side effect. The adverse effect is considered as the untoward effect of the drug. The side effect is considered as the what? Considered as the expected effect of the drug. So meaning, if for example, if you have heard a drug, a cardiac drug, those drugs ending in dipine, yan, yung mga dipine, somehow your parents may have it. For example, amlodipine, telodipine, nifedipine. Try to imagine, I have presented to you 3 drugs, but all of these drugs are ending in dipine. Although it ends in dipine, different drugs, they're only classified into one classification of drug, which is an anti-hypertensive drug. So, if you are aware of these dipines, amlodipine, nifedipine, and we have the amlodipine, nifedipine, telodipines, any generic will do, but enzindipine are anti-hypertensive drugs. On this note, one of the side effects of the drug is basically headache. Okay? Headache, side effect. It means that if you're aware that the side effect is headache, you expect that possibly the one who took it may experience headache. What the nurse will do if it is an expected effect of the drug? The nurse will instruct the client, ma'am, you will take this drug. This is in support to maintain and sustain your blood pressure within the normal range. However, after taking the drug, you will experience headache. Probably the response of the patients may be like this. I thought ayos yung BP ko. Why is it that I will experience headache? Although this may cause a discomfort for the client, but the challenge is the nurse must explain why the client will experience the headache. Because the headache is in response of the effect of the drug. So it is expected. Now, if it is expected by the patient, what the nurse will do is to what? Promote safety of the client. Because once the patient is in pain, it may lead to a possible risk of physical injury. So, what you will do as a nurse, ma'am, you will experience side effect of the drug much better after taking the drug. You have your rest so that to prevent or rather to prevent triggering of your headache. So you have explained well to the client that it is an expected effect. Now, how about if the client experience hypotension, which is not a side effect of the drug? If it is an untoward effect of the drug, you must be alarmed because hypotension is not an expected effect of the drug. So that's why it is called as adverse effect. If what is the concept, or what is the concept wherein higher level of adverse effect? Because adverse effect is already an alarm for a nurse that it will cause harm to the client. So higher level of adverse effect, the nurse must be alert to prevent higher level of harm. The higher level of harm or severe condition of adverse effect is already toxic effect. And once it lead to toxic effect, that's the point that I have oriented you and presented to you that it may lead to a problem with safety, right? And that possibly may lead to fatality. So those situations that I have presented to you, that pharmacology needs to present to you, it's not just only memorizing the drug. It is on how you will promote safety to your client and how you will present ideas to your patient to promote trust to you as a nurse that the one that you are giving to him or to her is what? Is for her safety and for her treatment. You will be convinced that the client could be convinced, and later on it will establish trust. So anything that may cause an error when it comes to medication, probably the trust could be one of the concern because you have committed error. So that's why it's very important for us that the knowledge in pharmacology is a major responsibility. There are many drugs that are coming out. There are many drugs that may come out in spite of this situation, and we must be aware of it. So, pharmacon, logos, the study of the preparation, properties, uses, and actions of drugs. So that's why I have also presented to you what is pharmacotherapeutics, what is the indication of the drug, what is pharmacokinetics, what is the mechanism action of the drug, and so on and so forth. Because from the examples that I presented to you, you have already realized the importance. The second definition focus on the science of drugs because it may lead to origin, composition, pharmacokinetics, therapeutic use, and toxicology. Do you know that there are drugs, okay? There are drugs that came from plants. So very obvious, came from plants such as very obvious herbal plants, lagundi. There are some drugs that came from there are plants that may be rare here in the Philippines, and it could be only imported from other countries. So it could be from plants, it could be from animals, it could be from viruses itself, those vaccines. So we are aware there are live virus or attenuated vaccines that could be administered to you. So those the existing vaccines, that's why it may need proper refrigeration of these drugs because somehow it may not be any more effective because of live yung composition itself. So it's very important for us that the science of drugs, this may also give us the idea on how it will be prepared, on how it will be stored accordingly. So another example, when is the time that you must withhold the drug or not administer the drug? Di ba we are checking expiration date? The expiration date is very important. But some of your probably grandparents, hello lolo, lola, some of your immediate relatives may tell you, pwede pa yan, mga isang buwan. It can be, ano lang naman, expired kahapon lang naman, you can still administer the drug. Expired pa lang naman 2 days. Class, the point that expiration date is being reflected in drugs because this may take risk anymore. Okay, there are some instances, sir, I gave an expired drug but nothing happens. Yes, nothing happens but it doesn't cause any effect. So pwede it may not lead to the possible potency. Kasi if we say, not the potency, not the vitamin C, potency. If we say potency, it refers to the effect of the drug. So, for example, what are the signs that you may not anymore that the drug may not anymore be administered? First, expiration date. Second, if there's a change in the color of the drug, will you still administer it? For example, there are some drugs, for example, coamoxiclav is an antibacterial, a third generation antibacterial. The color after dilution is yellow. It must be kept refrigerated. And you saw the color that is already dark orange. The original color is yellow. Will you still administer the drug even though it is refrigerated? The answer is no. Why? Any change in the color itself is an indication that it may not lead to potency or effect. Somehow it may cause an effect. It may not cause an effect to the patient because your liver detoxify it. But the point and objective of why administering the drug is for the treatment of the client. So you're not aiming on that direction. You just administered the drug, but you did not aim to promote the action of the drug, which is antibacterial. So that's why it's very important for us to know that expiration dates must be followed. We must also very keen and observant when it comes to when is the time that the drug cannot be anymore be given. Example, another example of situations if the drug is not anymore leads to potency. So potency is POTENCY. Potency is referring to the effect of the drug. We have one drug which is anti-anginal. Okay, sir, what is anti-anginal? If we say angina, that is referring to chest pain. New. So you will not anymore use are you experiencing chest pain? Not anymore. So if you're knowledgeable, you will ask now, are you experiencing angina? Wow, so that is chest pain. So there's a drug that is intended for the chest pain. And that drug is the brand name is Isordil. So I'll just give the brand name. The generic name is isosorbide dinitrate, but I'll take the generic Isordil. So just make a wild guess with my question. Usually, this drug are given during chest pain is an emergency situation, right? That is an indication, class, why chest pain is considered as an emergency situation. It's because the heart is already deprived of oxygen. And anytime, as what I've told you, if the cell will be deprived from oxygen, it will stop. It will stop the contraction, and anytime it may lead to cardiac arrest. So we must take into consideration that the heart must be revived with oxygen through the opening of the blood vessels. Now, the patient will take Isordil under the tongue, sublingual. I told you last time in our discussion, which of the 3 administration routes are most effective? Intravenous, sublingual, or oral? But the drug is not indicated for intravenous. So there are 2 ways na lang or administration route. It is either sublingual or oral. Which of the 2 may have an effective action or fast-paced action? Is it sublingual or oral route?
Sublingual po.
Sublingual. Very good. What is the rationalization why sublingual rather than oral? What if you can still remember the last discussion?
Popularize po yung ano.
Come again?
Vascularize po yung term.
Okay. So, have you mentioned about vascularize? Come again with your answer.
Marami pong blood vessels sa...
Yeah, good. So that's correct. That's correct. Because eventually, di ba, the action of the drug, the more that it may reach immediately to plasma, the higher chances of its fast-paced effect. So that's why in the sublingual, the action takes place because it's nearest to the blood vessel, and within the blood vessel is the blood that may carry it through plasma rather than through the oral that will reach pa the GI before it will reach the plasma. So that is basically our knowledge of why knowing this drug are given sublingually rather than the oral. And this is also very important that since chest pain is an emergency situation, then it must be given on a most possible way that it may lead a fast-paced effect of the drug, which is either intravenous or either sublingual. There could be some instances also, if you have observed, sometimes there are some situations that there will be contraindication. For example, for pediatric clients, if you have observed this in some of the what you call this telenovelas that you have watched, or some of the medical documentaries that you have watched, if for example the client is having febrile convulsion, the convulsion is caused by the high fever. Now, probably the one that you may think is to give a drug, which is a paracetamol, via intravenous. That's one. But there are some instances that there are some difficulties when it comes to the insertion of the intravenous site. The client is still convulsing, is having experience of convulsion. So what's the next? While the client is having convulsion, one of the effect of the convulsion or convulsive seizure brought about by the febrile convulsion is that of it will increase saliva. Will it be an alternative to give the drug via oral while the client is having convulsion? The answer is no. Why? Because there could be a possibility that during convulsion, the respiratory tract is open. If the respiratory tract is open, will there be a possibility that the drug that you will administer will not proceed to the GI and will proceed to the respiratory tract? The answer is a big yes.
Yes.
And what will happen if it will aspirate to the respiratory tract? Will it cause obstruction of the respiratory tract? The answer is yes. So, what will be the next alternative? It's not, we don't have the site for intravenous, we don't have the site for this oral or even sublingual. Do you know that there is paracetamol suppository? A paracetamol suppository can be administered via anus. Okay, yeah. So via anus, then once it will be inserted to the anal canal, inserted inside, do you know also, di ba, that intestines are highly vascular? So will there be the same concept? Will there be the same concept that if you have administered it sublingual, it's close to the blood vessel and nearest that it may reach plasma? It may also have the same concept that if the drug can be given into the anal, the suppository, it may be close also to the absorption of the intestine, and that's highly vascular and may reach the plasma. So that's another alternative. So that's why we have been oriented with routes of administration. And there are some instances, for example, let's go back to the problem with chest pain. Sir, the client or the adult client, usually for geriatric clients, right? Geriatrics and mga aged clients, they have very fragile blood vessels. So that's why there could be sometimes, there could be instances of delay insertion of the blood vessel. It may cause already inflammation. So the client is having chest pain already. Next, the client cannot take it via oral because the client having chest pain may lead to the possibility of respiratory tract open, may lead to aspiration. So there are two ways na lang. It's either sublingual or either another way around. The client may have a problem with sublingual because with the assessment of the nurse, the client have the oral defect which may contraindicate the administration of the sublingual drug. So will you just leave the ano? I rest my case. All of the routes I have known may not be possible for the client. No. There are still other routes to have the chest to treat the chest pain. We have topical. So what is topical? There is a patch. Yeah, but it could be the skin. There is a patch that can be placed on the anterior chest wall. So that may also consider as an alternative that, di ba, it will be absorbed by the skin, it could be absorbed by the layers of the skin, then it may reach to the what? It may reach to the blood vessel and carried by the plasma. Yun nga lang, the base, ang hirap sa topical, there could be slow absorption kasi it will pass through different layers pa. So can you imagine, it will pass through the epidermis, the dermis, the subcutaneous, kung fats pa, ang layo, subcutaneous, tapos before it will reach pa the blood vessels and reach the plasma. So very, very a longer period of time pa before absorption. So that's why when it will be administered through intravenous, it's direct not to the blood and may have an immediate effect via the plasma. So that's the situation of why the nurse must be knowledgeable with the science of drugs, because you must know many alternatives to still administer the drug and meet the objectives as well. So another is, in pharmacology, we need to consider the properties and reactions of drugs. What do you mean by properties and reactions of drugs? I have mentioned about the concept of side effect. That's the expected effect of the drug. The concept of adverse effect. That is the untoward effect of the drug. The higher level or severe level of adverse effect is already toxic effect. So once it reaches the toxic effect, you must need to know the concept of antidote. What do you mean by antidote? Anyone? I know some of you are playing some online games and you know what antidote is. Anyone who knows antidote? Yes, Mr. De Leon.
Pangontra po doon
Yes,
sa...
very good. Very good. The one that may contradict the action. The one that may contradict the action. So example, overdose of paracetamol. Example ha, overdose of paracetamol. Remember class, what are the two major organs when the client may have overdose that could be affected? The liver and the
Spleen.
and the livers. You have mentioned spleen. Pwede. Yes, because it's part of the GI. But the two major organs could be the liver and the kidney. Moreover, if you will have an overdose of paracetamol, class, don't also depend on paracetamol. Why? Because it is hepatotoxic. It will damage your liver. That's why, di ba, we have non-pharmacological management and we have pharmacological management. What do you mean by pharmacological? O pharmacological, when you're in pain, what is in your mind? When you have in fever, what is in your mind? Then we have paracetamol. But that's why you have been oriented with independent and dependent function. Di ba, with the dependent function, we categorize administration of drugs sa dependent. So non-pharmacological management is in the independent. If the patient may have fever, try to have first TSB, tepid sponge bath, ventilation. Because of the concept sa chemistry, you can still remember the conduction, direct effect or change in the temperature because of direct effect, conduction. Environmental, the change in the temperature that will cause is ventilation, proper ventilation through convection. Huwag nyo lang gagamitin ng radiation because it is not useful for the concept for treatment of fever. So those two are non-pharmacological. So if it doesn't work with the non-pharmacological, then lead to the pharmacological, which is paracetamol. Now, go back to the situation. If the client took overdose of paracetamol, some of you may have this concept, hey, paracetamol lang naman niya, wala namamatay dyan. Class, remember, any drug that reach overdose may lead to the possibility of damage to liver. And what is the action of the liver? The action of the liver is to detoxify. Then if ever the liver will be damaged, will it reach pa ba the point that the liver will have effective detoxification? Not anymore. So what will happen? It will increase the toxic level. The plasma will carry the toxic level itself in the blood, and it will reach the different organ. And once it reach the brain, then that's the point that it may affect multiple organ dysfunction. And remember, class, antidotes are very important so that to prevent toxicity. So this is just to give you the antidote for paracetamol is acetylcysteine or acetylcysteine. So that's why the client is having paracetamol toxicity. Okay, I have here acetylcysteine as antidote. Administer intravenously. So that may prevent, you are helping the liver, at the same time detoxifying it, and at the same time preventing it to extend or to have an extensive damage to other organs of its toxic level. So that is very important. Okay? So next po, any questions so far? Any insights? Any objections from the sharing and from the facilitation of concepts? Don't be hesitant, ha?
May
Okay.
tanong po.
Sir,
Yes, question.
Sir, pwede ka ba magpakamatay sa vitamin C?
Yes. Yes. Why? Remember, vitamin C is more on acidic, 'di ba? Acid. Too much acidity kasi class, the acid-base balance of the body, the two major organs that is relevant when it comes to acid-base balance is the lungs and the kidney. Now, so remember, if you have an overdose of the vitamin C, these two major organs will be affected. Why? Because the lungs is responsible to balance the acid base, and the kidney will also have the balance for acid base. So these two major organs could be damaged. Remember, the lungs, very vital for oxygenation. The kidney, very vital for elimination of toxins. If you may have the vitamin C, as a compensation, the kidney will really work, but will work harder than we expected. Kasi ang problem is, the acid-base balance is with this responsibility. Another concern, too much acid and too much base also may cause production of crystallization. Yung magki-crystallize yan. Kaya that's why too much acidity of urine, if you will check it in the urinalysis, it may appear that there will be appearance of crystals kasi it may cause the crystallization. And try to remember that these crystals can damage what? These crystals can damage nerves. These crystals can damage kidneys. The presence of crystals can damage kidneys, blood vessels of kidneys. And this may affect specifically elimination of toxins of the body. So that's why it's very important for us. Sasabihin nga, this is somehow a very good question eh. May namamatay po ba sa vitamin B? Vitamin B complex, may namamatay po ba sa vitamin C? On that note, very low yung chances of death. Very low yung chances of death because our major organs are working for detoxification. Liver and kidney is working. If your liver and kidney is working, it may not be fatal. But if you may have comorbidities or problem with liver and kidney, then higher chances of mortality rate. So that's a different situation. Any overdose is fatal. Any overdose is fatal. Although it may not immediately lead to death. Now once you have the one bottle, and then afterwards, in 1 minute, I'm dead. No, your body will still respond to balance and prevent toxic level. If you have healthy liver and kidney, you will not reach death. Definitely, you will not reach death. But I'm not assuring you, sabi naman pala rin sir, I will have overdose of vitamin C. Di ako mamamatay kung ayos naman yung liver ko. Remember, how about if the liver will not respond because of some limitation and circumstances? So not all of us may have the same response of liver and kidney. So what is the best? Prevent overdosage. Okay, that's it. That's the number one. But if ever you will encounter situations of patients who have overdose of the any of these multivitamins or anything, even supplements as well, what is again the two organs that you need to evaluate? Kidney function and liver function. Because eventually, for example, sabi ko nga sa inyo, nag-overdose ka pero umihi ka ng umihi. What does it mean? It means that your liver detoxified and your kidney are responding to eliminate toxins. Pero how about if you have taken sleeping pills? That's a problem. Why? If overdose of sleeping pills, your body will not respond spontaneously. Why? For example, you're unconscious. Even you have the urge. Even your nerves are working for you to eliminate urine, pero your body is not working because the urge lang, pero you will not feel the urge because you're unconscious. That's a problem. That's a problem because your body is not responding for urination because it may depend on your action of doing it. So that's why it's more complicated if those drugs that you have overdose is related to consciousness. Sleeping pills, anesthetics, steroids, not steroids. Mga drugs that may significantly affect narcotics. Those are the drugs that may affect consciousness. Those are the worst because try to imagine how the liver will detoxify if the effect is already directed to your brain. And we all know that the brain is the central action of the body. Once the brain will have this dysfunction, it will affect multiple organ dysfunctions. So that may lead to a possible early death compared to the vitamin C overdosage. Did I answer it clearly, Mr. De Leon? Oh, hindi ako galit ha. I'm just explaining it. Okay. Are there still any questions? Okay, none? So, may I continue po? Okay. Now, these are the 4 terms. Okay, these are the 4 terms that you may know or you may be familiarized when it comes to pharmacology. Pharmacokinetics, pharmacodynamics, pharmacogenomics, and pharmacotherapeutic. I have set its definition with the corresponding M's so that for you to inculcate and easily inculcate it into your subconscious mind. If we say pharmacokinetics, we're talking about movement. It derived from the term kinetics. Okay? So under the movement, we have remember the ADME, ADME. Remember the ADME when it comes to pharmacokinetics. Because in pharmacokinetics, these 4 stages of movement is very important. Letter A, absorption. Letter D, Letter D, distribution. Letter M, metabolism. And letter E, elimination. So try to imagine that movement. From the time that the drug is introduced to the client, how it will be absorbed. Then once it reaches the plasma, how it will be distributed. Once it reaches the liver, how the liver will metabolize. Once it reaches the kidney, how the drug will be eliminated. So that's the concept of pharmacokinetics. From absorption, di ba I have mentioned to you different routes of administration. What are those routes of administration? Sublingual, oral, topical. So there could be instances also other than intravenous. Paano sir yung intraosseous? Are you familiar with it? Intraosseous. So from the term itself, intra, inside, osseous, bone. Sir, nandun na ang blood formation mismo sa loob ng bone. So eventually, if we will administer the drug intraosseous or intravenous, will it be the same pace? Probably yes. Kasi it's direct to the blood already. So pag hindi siya possible with intravenous, the next possible way is intraosseous. But it may take a procedure pa, a different procedure if it is from intraosseous because it may need to have a special procedure to reach it with intraosseous. So with the time frame that you may have, it will be longer for the drug to be administered. Although the same effect or possible effect with intravenous. So those are the concepts that why we need to know routes of administration of absorption. What is the best route of absorption? When it comes to distribution, class, If it is oral and it reaches the stomach, the next thing to identify is how this will be distributed. And before it will be metabolized, the blood, or rather the drug must be what? The blood must be reaching the plasma before distribution. So once it reaches the plasma, any time for distribution. But M comes in, metabolism. Metabolism comes in because the liver will take its function to detoxify. The excess property that is not needed by your body must be eliminated. And that will have the function of, or the process or stage of elimination. So that's why it's very important that it must be eliminated. If it may not be eliminated, it may have increased chances of toxic effect. If it may not be detoxified by the liver, increased chances of toxic effect. How about if it may not be distributed? If it may not be distributed, then eventually it may not be it may not meet to the target of mechanism of action of the drug. How about, sir, if it may not be absorbed? Kasi class, there are some instances when it comes to absorption that may contradict effect of the drug. Example, there are some drugs that once you take it, it may not be mixed with milk. Why? Because it may break the milk, may break the chemical component and properties of the drug. Oh, hindi pala pwede yun. So it may alter absorption. It may alter absorption. Another, vitamin C tapos you will take pa juice. Can you imagine that? You will take citrus juice tapos you will take vitamin C at the same time. So can you imagine the acid itself? So pag in-increase mo pa yung acid, pagpunta pa sa stomach niyan, ano pa yung mamimit ang magwe-welcome pa in the stomach? Hydrochloric acid. Oh, what will happen? What will happen? It will have premature breakdown. So try to imagine that the component, the properties are already breakdown with too much acid itself. So what will happen? So less percentage of its component and property will be absorbed na by the intestine. So will it be effective? Not anymore. So those are the instances that may contradict specifically and it may cause premature breakdown of drugs if it will mix with other food. Okay? So later I will give you those ideas in the next discussion that we may have. Next, pharmacogenomics. If you say pharmacogenomics, make up genes. Okay, do you know class that the effect of drugs may be different from a male and a female? Why? Class, most of the hormones can be present also for males and can be present for females. Do both males and females do have testosterone? Do both males and females do have testosterone?
Mas mababa lang.
Yeah. Remember, both gender have. Male have higher testosterone, female have lower level of testosterone. Kaya can you imagine for a male, pag higher level of testosterone, mas hairy, mas tinutubuan ng bigote ng bird. Kasi high ang level ng testosterone. Pero can you imagine for a female who may have higher level of testosterone? They're the ones na increase ang hair growth sa legs, increase ang hair growth sa kilikili. Nagkakaroon din sila ng hair growth sa facial features because of the effect of testosterone. However, sir, both of the male and female may have testosterone, but the point of yung concept itself is it may have different level. So ibig sabihin, sir, instances male may have higher testosterone and female may have lower testosterone. Plus, the higher the hormone level, the increased chances that the drug may have increased metabolic response or metabolism. So, ibig sabihin, kung mataas ang if there is an increase in the hormone level, the greater chance that it will increase metabolism through the action of the liver. If there will be a decrease in the level of hormones, the greater chances that it will delay metabolic response of the drug. So that's what I am talking about. But common actions with male and female. That's why in some researches, why they conduct research of drugs, of effects of drug to male and female. Why we are talking about those demographics? Why we conduct study of drugs of effect to children and to adult? Because children and adult may have different response of metabolism. Children may have high metabolism or metabolic response. Adult may have what? May have low metabolic response. Why vaccination prioritizes the geriatrics rather than the pediatrics? We have heard about that the children have high immune system compared to the geriatrics or the aged population. One concept that is correct. Because remember class, cytokines po in the COVID, cytokines is an anti-inflammatory substance of the body. This will prevent inflammation. Class, remember yung concept that we have discussed last time that microorganism, bacteria or virus may damage tissues and may lead to inflammation. Just the same as for the COVID-19, that if the SARS-CoV-2 may cause damage to tissues and may cause inflammation, it will constrict the airway passages. The cytokines is the natural substance of the body that is released by the body to prevent. It's an anti-inflammatory property. So, what is now the difference of adult and pediatric? Higher level of cytokines in children, low level of cytokines in adult. So, ibig sabihin, which of the two population may have a control of preventing COVID-19 and may have higher chances of anti-inflammatory cytokines? Children or the aged? Which of the two has low? The children or the geriatric population? Geriatric. Because of the concept that it has low cytokines, so low anti-inflammatory response. Kaya lumabas in the early part of the COVID-19 na most of the populations na affected ay aged kasi sila yung low cytokine, decrease ang metabolic response. Unlike for children, mataas ang cytokine level, mataas ang anti-inflammatory response to prevent inflammatory caused by COVID-19. So just the same as for drugs, it may have delay effect for adult, but efficient effect for the children. Because remember, in a normal physiologic change, di ba, even the skin from children to adult to geriatrics change its integrity. It's because of the metabolic response. For adults, for geriatric clients, water cannot anymore not anymore have the effective capacity to reserve water in skin. So that's why it's different from adult and different from the pediatric. So if the drug will be administered topical to a geriatric compared to adult, which of the two may have effective absorption? The adult, because of the intact integrity of skin, and the cells will respond to the absorption. Compared to what? Compared to a geriatric client whose cells cannot anymore reserve fluids, may delay absorption of the drug. Can you relate with my examples, students?
Yes po.
Are you still conscious? If you're still conscious, that's an indication that you're still try to connect yourselves in pulse oximeter. So if you're connecting yourself to the pulse, where's my pulse oximeter? If you're connecting yourself to the pulse oximeter, ibig sabihin, if you're conscious, you're still having 95 to 100. 95 to 100 pulse oximeter or oxygen saturation, that is normal. But if you check your pulse oximetry or oxygen saturation that is 94 and below, it means that your brain is not absorbing anymore what I am discussing, because oxygen level is not anymore sufficient to your brain to reserve and absorb learning. So what is the cause of this problem in oxygenation? Probably You are hungry. Because your brain cells are not anymore receiving sufficient oxygenation due to the nutrients from food. Kaya for those, have your fluid muna ha. Intake of fluid. You need hydration. With this long discussion that we may have, even though it will be 2 hours, it may be difficult for you to absorb. So just an advice to all of you, maintain, nourish yourself. Not with lactum, but nourish yourself with fluids. Next. Any question from the 1, 2, 3, 4? Yeah, I forgot pala. Other than the pharmacogenomics is pharmacotherapeutic. Pharmacotherapeutic, I have explained this, that this concerns with the indication of the drug. That's why my term is maximum. Why maximum? Because that's the time that the drug is already leading to its indicated action of treatment. That's why I mentioned to you, if I gave salbutamol, if we say pharmacotherapeutic, the maximum effect is for the respiratory system. So it already identified, the drug already identified its action to a certain condition. So again, pharmacokinetics, we have the movement. And remember, ADME, absorption, distribution, metabolism, elimination. If we say pharmacodynamics, this refers to mechanism. And that refers to action, mechanism of action. If we say pharmacogenomics, this refers to the makeup genes. And number 4, pharmaco, so that's a wrong spelling. I stand corrected. Pharmacotherapeutic maximum. Any question before I proceed with the next slide? Are you still okay?
Yes po.
Okay.
Yes po.
So if you're not okay, so we may have siguro 5-minute break for you to hydrate. For you to hydrate, have stretch your body and have your oxygenation if you are hungry, so that your cells will be active in its function. So this will be by next slide after 5 minutes. Because the next slide that I will be showing to you are those questions that are retrieved from the various question banks and related to pharmacology. So let's have let's have first a break and have our 5 minutes to increase our oxygenation. So it's already 6:38. So I hope the 5 minutes you have already have your health break for 5 minutes and be hydrated accordingly for us to have our neurotransmitters be active. Okay. Before I proceed with the self-assessment exercise, I have received a question from the chat that, sir, is there a problem if the drug that is supposedly be given sublingual had been taken by the client oral? Actually, the point why there is a corresponding indication of which route is appropriate for the drug is that of its fast-paced effect. It may not cause harm if the drug that is supposedly sublingual had been taken orally. The problem lang with that is since it has been taken orally, the drug may lead to a delayed effect since from the stomach, it may be absorbed towards the intestine, then it will be detoxified pa by the liver. Most of the oral drugs are being detoxified by the liver before it will be metabolized. That's for sure. That's the difference. So the time frame that is expected for oral drugs may be different if it will be given sublingual. So your question is, first and foremost, we must be careful when it comes to the route of administration. If it is must be given sublingual, much better given sublingual because it is most effective given sublingually. But your question is, how about if the client took it orally? It may not possibly cause harm, but it may delay the effect as expected supposed to be given sublingually. So careful then because we must be aware of the appropriate administration. Okay, now the slides that you are now witnessing in front of you are self-assessment exercises. So we will answer questions on this. The nurse who is caring for a client explains the movement of drug into, through, and out of the body. Is it pharmacokinetics, pharmacodynamics, pharmacognosy, pharmacotherapeutics? Yes, Mr. Arbo.
Sir, miss po.
I'm sorry, Miss Arbo.
Okay
I'm
lang po.
sorry. Miss
A po,
Arbo.
yung pharmacokinetics po.
Okay. This is just a tip when you encounter questions. I have presented to you the 4 M's in the 4 pharmacology concepts. Di ba we have pharmacokinetics, movement, pharmacodynamics, mechanism, pharmacogenomics, makeup genes, pharmacotherapeutics, maximum. If you will observe in the question, the nurse who's caring a client explains movement of drugs. The movement itself will give you the idea of what will be the direction in the choice. So, let's reveal the answer. The answer is pharmacokinetics because as what we have mentioned in pharmacokinetics, this refers to movement. Next question. Pharmacokinetics can be simply described the study of what body does to the drug, except the rate and extent to which drugs are absorbed into the body and distributed to the tissues. The rate and pathways by which drugs are eliminated from the body by metabolism and excretion. C. The relationship between time and plasma drug concentration. And letter D, the drug produces biochemical and physiologic changes in the body. Remember, class, when we talk about pharmacokinetics, we have talked about ADME, right? We have talked about concepts of absorption, distribution, metabolism, and elimination. But in the question, what the body does to the drug, except, meaning from the 4 choices, which of the 4 choices is incorrect about pharmacokinetics? Okay, so I think Jay Abilino,
Letter C po.
letter C. Okay, so how about for the others? So let's see what's the answer if it is letter C. Oh, why it's not letter C? Okay, now why the answer is letter D? I will explain to you. In letter A, the rate and extent of which drug is absorbed and distributed to the body tissues. Di ba I have already presented to you pharmacokinetics, ADME? So what is the key term in letter A? Absorbed and distributed. So the statement is correct about pharmacokinetics. Letter B, the rate of pathways by which drugs are eliminated from the metabolism and excretion. Di ba? ADME, ME, metabolism, excretion. That is still part of the pharmacokinetics. Letter C, the relationship between the time and plasma drug concentration. Why letter C is still part of the pharmacokinetics? Remember the concept that I mentioned to you about absorption? That when the drug enter either sublingual or either within oral or the stomach, it is related to the time frame that the drug will be absorbed by plasma. Diba you have mentioned that it will be absorbed eventually on a fast pace yung drug pagka-sublingual because it's close to the blood vessel and near to the plasma or distribution. So why letter D is not the answer? Why except about pharmacokinetics? Thank you for the try and I appreciate it. The drug produces biochemical and physiologic change in the body. This is more on pharmacodynamics. Why pharmacodynamics? Kasi class, mechanism. The drug is already taking effect to the body. Is starting to have response. Kaya that's why in pharmacodynamics, we will talk about side effect. We will talk about adverse effect. So dyan na yung time wherein the drug is now being distributed after the 4 ADME. The absorption, distribution, metabolism, elimination, then proceeds na to pharmacodynamics. So letter D is referring to pharmacodynamics. Next question. So try to imagine yourself because in the board exam you may not expect questions eh. So if it could be this way that you will encounter, then you will just use the guess and using critical and analytical thinking. Okay, next question. The nurse is aware that the maximum use of drugs to treat specific disease or produce desired effect. Pharmacokinetics, pharmacodynamics, pharmacogenomics, pharmacotherapeutic. Alangkas, Jaila?
Letter D po.
Letter D. You're talking letter D?
Opo.
Letter D? Okay. What is the term in the question that guided you? Why letter D?
Maximum po.
Let's see
Maximum.
if your answer is correct. The answer is pharmacotherapeutic. From the question itself, it guided you that it is all about the maximum use of drug for treatment. So pharmacokinetics, movement, pharmacodynamics, mechanism, pharmacogenomics, makeup genes, pharmacotherapeutics, maximum. Next question. The nurse noted harmful, unintended reaction of the drug, which refers to, let's see, desired effect. Letter B, adverse effect. Letter C, toxic effect. Or letter D, side effect. Okay, we have Miss Castro Lewina.
Letter B po, adverse effect.
Adverse effect. So let's see. Let's see. So I will reveal the answer. Correct. The answer is adverse effect. Why? Because I mentioned to you the difference between side effect and adverse effect. because the adverse effect is untoward. So anything that is unintended, anything that may cause harm, anything that already caused harm to the client on the effects of the drug, that is adverse effect. If we talk about side effect, that is the expected effect of the drug. If we talk about desired, okay, if we talk about desired effect, this is the effect that is related to its target organ. The action is already has in its effect to the target system or organ. Now, if we talk about toxic effect, this is a severe level of adverse effect. Next question. Next question. The nurse notifies physician due to a serious adverse effect that occurs of the drug reaches dangerous and life-threatening level. A, side effect. B, adverse effect. C, toxic effect. Letter D, desired effect. Okay, we have the first one, Miss Kyla, Delarmente.
C po din, toxic effect po.
Toxic effect. So let us now reveal. The answer is very good. We have toxic effect. Why toxic effect? What is your guide in the question that leaded you why toxic effect?
The drug reaches dangerous and life-threatening level po.
Okay, so that's one. Meron pa. You may also notice another one.
Serious adverse effect po.
Very good. You're learning well, ha? You're easily learning well on how to identify the direction on the answer. Very good. There will be two. Serious adverse effect, because severe and serious adverse effect is toxic. Once it is already dangerous and life-threatening, that is already toxic effect. Thank you. Next question. The nurse emphasizes in her health teachings on the reduction in effectiveness of medication in treating a disease or condition. That refers to drug tolerance, drug resistance, drug dependence, or drug abuse. Okay, I've seen Harold. Mr. Harold?
Letter B po din.
Letter
Drug resistance po.
Drug resistance. Okay. Now, what is your key terms that you have identified in the question?
Reduction in effectiveness of medication po.
Okay. So let us see if that will be the answer. Correct. Very good. You're learning well. I did not mention these terms, but you are already gearing to that direction. Why? The reduction in effectiveness is already resistance. Have you heard about antibiotic resistance? That's why it is not advisable to do self-medication. Because eventually, if you have self-medication specifically with antibacterial, there could be instances that in the future, when you will be prescribed with the same antibiotic, there could be possibility that the drug may not anymore take its desired effect to your body because it reached already the drug resistance. It's not taking anymore its effect. So, other example with the drug resistance. Kasi actually, class, if you have learned this in your microbiology and parasitology, you have learned about culture and sensitivity test, right? You have learned about culture and sensitivity. Di ba may mga bacteria that are gram-positive, bacteria that are gram-negative, because there are drugs that may target only gram-positive and gram-negative. So, if for example, if the patient did not undergo those procedures, pero eventually, with his condition, as prescribed by the doctor, from the symptoms and from the test, it may direct to direction of prescription because that is the most appropriate antibiotic based from the presentation of test results. But if the person will do self-medication and, for example, the antibiotic that he's taking is beyond dun sa supposedly intention, which is gram-positive, but more of the bacteria on your health condition is gram-negative, it may not suffice and support specific intention of the drug. It is just It is just a waste of the drug to enter the body, and that leads to the possibility of resistance. Next, what is drug tolerance? Drug tolerance meaning from the time that you have taken the drug until you reach the desired effect and no adverse effect had been noted, that's drug tolerance. Next, letter C, drug dependence. Drug dependence, I have addressed to you the difference between pharmacological and non-pharmacological. A person may be drug dependent, he or she is not using alternative means of non-pharmacologic treatment. The drug dependence is, for example, the patient can only be relief, can only experience relief of pain when taking a pain reliever. So no non-pharmacological measures, but more on dependent on drugs. So that's drug dependence. So possibly it may not relieve anymore through non-pharmacological management. Drug abuse, the drug abuse is you are dependent on the drug, but basically it's already overdose. You are leading to the chances that you're abusing because it is on overdose and it may possibly create damage already, and it could be life-threatening as well. So these are the differences between drug tolerance, drug resistance, drug dependence, and drug abuse. Next question. The nurse assists the client after taking the medication on the expected physiologic response that is unrelated to the desired action of the drug. Letter A, toxic effect. Letter B, adverse effect. Letter C, side effect. And letter D, we have desired effect. So I think I've seen Kyle Abante.
In side effect.
Side effect. Okay. Question. From the question, what term or phrase guided you to have an answer of side effect?
Yung expected physiologic response that is unrelated to the desired action.
Okay, kasi nandun yung term na expected. So let's see. So the answer is side effect. You're correct. Because as what I've mentioned, even though I did not mention expected, I mentioned the toward and the untoward effect of the drug. That is still expected, although sometimes unrelated siya. What do you mean by unrelated? For example, the one that I set an example. The client is taking anti-hypertensive, pero expect that the client will experience headache. So side effect siya. Expected mo even though if it is unrelated to the desired action. So it gives you a preparation on how you will give health education and health teachings to your client. Okay, next question. The nurse understands that the ability when the client endure ordinarily injurious amounts of drugs or the lowering effect obtained from an established dose that requires raising the dose to possibly toxic level to maintain the same effect. This question is very long, very tricky, and somehow confusing. So let's have choices. Drug reaction, drug dependence, drug effect, drug tolerance. So imagine yourselves that you have encountered this question and you will analyze it. So I think the first one is still Miss Abante. Kyle?
In drug dependence.
Drug dependence. Okay. So what is the phrase that you have been guided in the question leaded you to the answer of drug dependence?
Yung raising the dose to possibly toxic level. So,
yeah. Let's see. So the answer is why? Ito po ha. Ito yung ano. Kasi you're leading to the situation na drug dependence. Ang term kasi dito is injurious amounts or lowering the effect. Kasi di ba pag sinabi nating dependence, it's either directly increasing. Okay? Increasing. Nagiging dependent ka na eh. The more that you increase the dose, you're becoming dependent. But if it reaches already yung dose that is already beyond as an overdose, doon na pumapasok si toxic effect. Ito naman yung why we say this as tolerance. Kasi drug tolerance from endure ordinarily injurious amounts of a drug or the lowering of the effect obtained from established dose. So if we say established dose, that requires raising the dose to possibly toxic level to maintain the same effect. Ganito po yun. For example, we have some instances that, for example, the client was brought brought to the emergency room is on a severe what you call the severe infection. The severe infection primarily because it already spread to the circulation. You are aware of the specific dose that can be given to the client. But in the situation of severe infection, you may either go beyond to the dosage because of the severe infection. But that could be once, so that to have this drug have the action to the patient. So why is it drug tolerance? In spite of the higher dose that the client have, it did not reach toxic level. But it depends particularly on the health condition of the patient. Kaya that's why yun yung tinatawag nating loading dose. Most of the loading dose may have higher dose than the usual routinary dose that are given to the client. Because eventually, if there is severe infection that the client may have, probably the client, given the higher dose, but targeting the severe infection and do not have harmful effect to the client, that's what you call drug tolerance. Okay, so that's why I mentioned to you from the time that the drug had been given to the patient up to the desired effect and doesn't have any manifestations of adverse reactions, that's drug tolerance. So thank you very much for the effort of having the answer. Really appreciated it. Next question. The nurse observes the client on the physical and psychologic reliance on chemical agent resulting from continued use and abuse or addiction. So we have therapeutic effect, drug dependence, drug interaction, desired effect. So in here it seems very obvious yung answer. So I think the one Miss Cipriano.
Drug dependence po.
Drug dependence. So let us see if the answer is drug dependence. Okay. Why drug dependence? What is in the question? What is in the question that guided you to have drug dependence?
Yung reliance on chemical agent po.
Very good. Kasi you rely. You rely kasi 'di ba reliant. I can rely on you. I can depend on you. So that's why the client only depend that no other drug, he or she will mention, no other drug can definitely relieve my pain, but only this drug. So that's drug dependence. Therapeutic effect and desired effect are the same. Okay, this therapeutic effect and desired effect are the same, which is leaded to its intended action. And drug interaction is that of, this refers to when two drugs are taken at the same time on the same category. Example of drug interaction. Example, di ba class, you're aware of anti-TB drug. And anti-TB drug you can in 6 months, you will not just only take rifampicin. In 6 months, you will take also other anti-TB drugs. So we need those 3 anti-TB drugs so that to support interaction with each other and treat tuberculosis. So yun po yun. There are drugs that will interact in each action so that it may lead to its desired effect. So I think it's almost 7 o'clock. However, as what I have mentioned, you may have we will have the asynchronous session, and you may watch the video on the clinical trials. This is an advanced viewing of our topic, but the task can be submitted up to Sunday. So I will stop